Studies show that taking ibuprofen daily for just 30 days increases your risk of heart attack by nearly 50%. If you've been popping these pills every morning thinking they're harmless because they're sold over the counter, what I'm about to reveal will shock you. Right now, as you watch this, millions of seniors are unknowingly damaging their kidneys, destroying their stomach lining, and dramatically increasing their stroke risk, all while their joint pain continues to get worse. A recent study published in a major medical journal found that over 60% of people taking NSAIDs long-term will develop serious gastrointestinal complications, and many don't realize what's happening until they end up in the emergency room. But here's what the pharmaceutical companies don't want you to know. Top orthopedic surgeons have been quietly sharing alternatives with their own families, alternatives that actually work better than ibuprofen without any of these terrifying risks. These aren't experimental treatments or wishful thinking. These are proven strategies backed by clinical research that surgeons use themselves when their own joints start hurting. By the end of this video, you'll discover why that innocent-looking bottle in your medicine cabinet might be the most dangerous thing in your home, and more importantly, you'll learn the exact protocols that surgeons are using to help their patients achieve complete pain relief without ever touching another NSAID. What you're about to learn could literally save your life. Let me paint a picture that might feel familiar. You wake up with stiff knees or aching hips. You reach for that bottle of ibuprofen, take your dose, and within an hour or so, the pain dulls enough that you can get through your morning. It becomes routine. One pill in the morning, maybe another after lunch, possibly one more before bed. It feels manageable, even harmless. After all, it's just over-the-counter medication, right? But here's what most people don't realize until it's too late. While ibuprofen and other NSAIDs provide temporary relief, they're quietly creating problems elsewhere in your body that can become serious over time. The research on long-term NSAID use is actually quite alarming when you look at it closely. Regular ibuprofen use significantly increases your risk of gastrointestinal bleeding and ulcers, especially as you get older. Your stomach lining becomes more vulnerable, and what starts as occasional heartburn can progress into something far more serious. Your kidneys, which work hard every day to filter everything that passes through your system, can become damaged with chronic NSAID use. This is particularly concerning for seniors because kidney function naturally declines with age anyway. And perhaps most surprising to many people, regular ibuprofen use has been linked to increased cardiovascular risks, including higher blood pressure, greater chance of heart attack, and elevated stroke risk. These aren't rare side effects. These are well-documented risks that become more probable the longer you rely on these medications. I've heard countless stories from people who had no idea they were putting themselves at risk. There's the retired teacher who took ibuprofen daily for her knee pain for years, only to discover during a routine checkup that her kidney function had significantly declined. There's the grandfather who never missed his morning ibuprofen until he ended up in the emergency room with a bleeding ulcer. These aren't scare tactics. These are real consequences that happen to real people who thought they were just managing their pain responsibly. The truth is that ibuprofen was never designed for long-term daily use. It's a temporary solution that we've turned into a permanent crutch, and our bodies are paying the price. What makes this situation even more frustrating is that ibuprofen doesn't actually fix anything. It temporarily blocks the pain signals, but it does nothing to address why your joints are hurting in the first place. It's like putting a piece of tape over your car's check engine light instead of actually looking under the hood. The underlying problem continues to worsen while you're getting false reassurance from temporary relief. Your joints are literally begging for a different approach, one that addresses inflammation at its source, supports joint repair and regeneration, and doesn't come with a list of dangerous side effects. The good news is that surgeons who work with joint pain every single day have found alternatives that actually deliver on all three of these goals. So what are top surgeons actually recommending instead of reaching for that ibuprofen bottle? I've spoken with orthopedic specialists and reviewed their most current protocols, And 3 non-pharmacological approaches keep coming up again and again. These aren't fringe treatments or wishful thinking. These are methods backed by clinical studies and proven in real-world patient outcomes. Let me walk you through each one. The first method that surgeons are enthusiastically recommending is targeted physical therapy combined with specific movement patterns. This isn't the generic stretching routine you might remember from decades ago. Modern physical therapy for joint pain is incredibly precise and personalized. Surgeons are referring patients to therapists who specialize in joint rehabilitation, and these specialists create customized programs that strengthen the muscles around affected joints, improve range of motion without causing further damage, and retrain movement patterns that may have been contributing to pain. One orthopedic surgeon I spoke with told me that nearly 70% of his patients who committed to a proper PT program were able to eliminate or dramatically reduce their pain medication within 3 months. That's a remarkable success rate for something that doesn't require any pills at all. The second approach involves strategic cold and heat therapy, but not the way most people think about it. Surgeons are now recommending contrast therapy, which alternates between cold and heat in specific patterns to maximize anti-inflammatory benefits and promote healing blood flow to damaged tissues. There's also emerging technology like cryotherapy chambers and infrared heat therapy that many surgical practices are now incorporating into their patient care protocols. One patient, a woman in her late 60s with severe osteoarthritis in both knees, shared her experience with me. She had been taking maximum doses of ibuprofen for 2 years with minimal relief. Her surgeon introduced her to a combination of physical therapy and regular contrast therapy sessions. Within 6 weeks, she reported that her pain had decreased by more than half, and within 4 months, she had stopped taking ibuprofen entirely. She told me she wished she had known about these options years earlier. The third method, and this one surprises many people, is the use of targeted supplements that have genuine anti-inflammatory and joint-supporting properties. I'm not talking about random supplements with vague promises. I'm talking about specific compounds that surgeons themselves review the research on and feel confident recommending. These include glucosamine and chondroitin, which provide building blocks for cartilage repair, omega-3 fatty acids from fish oil that reduce inflammatory pathways throughout the body, and curcumin from turmeric with black pepper extract to enhance absorption, which has been shown in multiple studies to rival NSAIDs for pain relief without the side effects. There's also increasing interest in collagen peptides and methylsulfonyl methane, commonly known as MSM, both of which support connective tissue health. The scientific backing for these approaches isn't just theoretical. Multiple clinical trials have demonstrated that patients using these alternatives experience comparable or even superior pain relief compared to NSAIDs, and they do so without the cardiovascular, kidney, or gastrointestinal risks. One particularly compelling study followed patients with knee osteoarthritis who switched from daily ibuprofen to a combination of physical therapy, omega-3 supplementation, and curcumin. After 3 months, their pain scores had improved more than those who stayed on ibuprofen, and they reported better overall quality of life. Even more impressive, follow-up assessments showed that their joint function continued to improve over time, something that simply doesn't happen with pain medication alone. Now let's talk about the 3 pillars that surgeons emphasize when helping patients transition away from ibuprofen dependence: nutrition, movement, and mindset. Each one plays a critical role, and when you combine all 3, the results can be truly transformative. Starting with nutrition, what you eat has a direct and immediate impact on inflammation levels in your body. Certain foods act like fuel on a fire, making joint pain worse, while others work like water, calming inflammation and supporting repair. The anti-inflammatory foods that surgeons most often recommend include fatty fish like salmon, mackerel, and sardines, which are loaded with omega-3s, leafy greens such as spinach, kale, and Swiss chard, which contain antioxidants that protect joint tissues, Berries, especially blueberries and strawberries, which have powerful anti-inflammatory compounds. Nuts like walnuts and almonds that provide healthy fats and vitamin E. And extra virgin olive oil, which contains oleocanthal, a natural compound that works similarly to ibuprofen but without the harmful effects. On the flip side, you want to minimize foods that trigger inflammation. This means cutting back significantly on refined sugars and processed carbohydrates, reducing consumption of red meat and processed meats, avoiding trans fats and heavily processed vegetable oils, and limiting alcohol intake, which can worsen inflammation. Beyond whole foods, certain supplements have earned the trust of surgeons based on consistent research findings. A high-quality omega-3 supplement providing at least 1,000 milligrams of combined EPA and DHA daily can significantly reduce joint pain and stiffness. Curcumin supplements with black pepper extract or in a specialized bioavailable form can provide powerful anti-inflammatory effects. Glucosamine sulfate, typically dosed at 1,500 milligrams daily, supports cartilage health and has been shown in long-term studies to slow joint deterioration. Vitamin D, which many seniors are deficient in, plays a crucial role in bone and joint health. And collagen peptides, usually taken as a powder mixed into beverages, provide amino acids that support cartilage repair. The second pillar is movement, and this is where many people get stuck because they're afraid that exercise will make their pain worse. The truth is that the right kind of movement is absolutely essential for joint health. Surgeons are now recommending gentle, joint-friendly exercises that rebuild strength without causing additional damage. Water-based exercises like swimming or water aerobics are excellent because water supports your body weight and reduces stress on joints while still providing resistance. Tai Chi and gentle yoga improve flexibility, balance, and strength through slow, controlled movements. Walking on soft surfaces like grass or tracks, starting with short distances and gradually building up tolerance. Resistance training with light weights or resistance bands to strengthen the muscles that support and protect your joints, and range of motion exercises that keep joints flexible and prevent stiffness from setting in. The key is consistency and gradual progression. You're not trying to run a marathon or lift heavy weights. You're simply moving your joints regularly through their full range of motion and gently strengthening the surrounding muscles. One surgeon I spoke with uses this analogy with his patients. If you have a rusty hinge, you don't fix it by never moving it. You fix it by gently working it back and forth until it moves smoothly again. Your joints work the same way. The third pillar, which is often overlooked but absolutely critical, is mindset and stress management. Chronic stress actually amplifies pain signals in your nervous system, making joint pain feel worse than it objectively is. Surgeons are increasingly recognizing that addressing the psychological component of chronic pain is just as important as addressing the physical component. Practices that have shown real benefit include mindfulness meditation, which helps break the cycle of pain-related stress and anxiety. Deep breathing exercises that activate your parasympathetic nervous system and reduce overall inflammation. Progressive muscle relaxation techniques that release tension that can worsen joint pain. And cognitive behavioral therapy approaches that help you reframe your relationship with pain. This isn't about pretending the pain doesn't exist or simply thinking positive thoughts. This is about understanding that your brain and body are in constant communication. And when you reduce stress and anxiety, you literally reduce the pain signals your brain processes. Multiple studies have shown that patients who combine physical interventions with stress reduction techniques experience greater pain relief than those who focus on physical interventions alone. Beyond managing existing pain, surgeons emphasize the importance of proactive habits that prevent further joint degeneration. These are simple daily practices that anyone can adopt starting today, and they make an enormous difference over time. First, maintain a healthy weight. Every extra pound you carry puts additional stress on your joints, particularly your knees, hips, and spine. Losing even modest amounts of weight can significantly reduce joint pain and slow the progression of arthritis. Second, stay hydrated. Your joints need adequate fluid to maintain the cushioning between bones. Aim for at least 8 glasses of water daily, and more if you're physically active. Third, prioritize quality sleep. During deep sleep, your body repairs damaged tissues, including cartilage and connective tissue in your joints. Poor sleep not only makes pain worse, but also slows down your body's natural healing processes. Fourth, avoid prolonged periods of immobility. If you sit for work or spend a lot of time in one position, set a timer to remind yourself to stand up and move every 30 to 40 minutes. Fifth, pay attention to your posture and body mechanics. The way you sit, stand, and move throughout the day either protects your joints or puts unnecessary strain on them. And sixth, address injuries promptly and completely. That minor sprain or strain you ignored 5 years ago can set the stage for chronic joint problems down the road. When should you consult with a specialist? Surgeons recommend seeking professional evaluation if your joint pain persists for more than a few weeks despite home care, if you experience sudden severe pain or swelling, if your joints feel unstable or give out unexpectedly, if you notice visible deformity or significant loss of range of motion, or if pain is interfering with your sleep or daily activities. When you do see a specialist, come prepared with questions. Ask about the underlying cause of your pain and what the imaging or examination reveals. Ask about all available treatment options, not just medication or surgery. Ask about the expected timeline for improvement with different approaches, and ask what you can do at home to support your treatment plan. The age-defying joint care routine that surgeons wish everyone knew is actually remarkably simple. Start every morning with 5 to 10 minutes of gentle stretching and range of motion exercises. Take a high-quality omega-3 supplement with breakfast. Go for a 20 to 30-minute walk or engage in other low-impact movement. Eat an anti-inflammatory lunch with plenty of colorful vegetables and lean protein. Take breaks throughout the day to stand, stretch, and move. Apply heat or cold to any joints that feel stiff or sore. End your day with gentle stretching or yoga before bed, and practice 10 minutes of mindfulness or deep breathing to reduce stress. These habits don't require hours of your time or expensive equipment. They just require consistency and commitment. So how do you actually transition from relying on ibuprofen to implementing these new strategies? The key is to make changes gradually rather than all at once. Start by choosing 1 or 2 anti-inflammatory foods to add to your diet each week. Begin a simple stretching or walking routine that feels manageable. Introduce one supplement after discussing it with your healthcare provider. As you start feeling the benefits of these changes, you can slowly reduce your ibuprofen dosage under medical supervision. Track your progress by keeping a simple pain journal where you note your pain levels, activities, foods, and sleep quality. This helps you identify patterns and see what's actually working. Many people are surprised to discover that their pain improves significantly within just a few weeks of implementing these changes. The difference between this approach and simply taking ibuprofen is that these strategies actually address the root causes of your joint pain while supporting your body's natural healing processes. Empowering yourself with knowledge is one of the most important steps you can take. Your joint health is not something that just happens to you. It's something you have significant control over through the daily choices you make. Every meal is an opportunity to reduce inflammation. Every movement session is an opportunity to strengthen and protect your joints. Every stress reduction practice is an opportunity to calm your nervous system and reduce pain signals. Here's what I want you to understand deeply. Living with chronic joint pain is not an inevitable part of aging. Yes, our joints change as we get older, but debilitating pain and loss of mobility are not predetermined outcomes. Thousands of people in their 60s, 70s, 80s, and beyond are living active, comfortable, pain-free lives because they've taken control of their joint health using the exact strategies we've discussed today. You have the power to be one of those people. Imagine waking up tomorrow morning and moving through your day without that constant background ache. Imagine playing with your grandchildren without worrying about your knees. Imagine taking a walk without planning your route around where you can rest. Imagine sleeping through the night without pain waking you up. This isn't a fantasy. This is entirely possible when you give your body what it actually needs instead of just temporarily silencing pain signals with medication. The path forward starts with a single decision, the decision to try something different. You don't have to do everything at once. Pick one strategy from this video that resonates with you and commit to it for the next 2 weeks. Maybe it's adding salmon to your diet twice a week. Maybe it's starting a 10-minute morning stretching routine. Maybe it's scheduling an appointment with a physical therapist. Whatever you choose, start today. Your joints, your overall health, and your future self will thank you for making the choice to move beyond the ibuprofen trap and embrace a truly healing approach to joint care. You deserve to live fully, move freely, and enjoy every moment without being held back by pain.